Hi, I'm Dr. Joshua Huffman. I'm a board-certified chiropractic neurologist. I'm also a diplomate of the American Board of Anti-Aging Health Practitioners, a diplomate of the American Association of Integrative Medicine, and I also have a fellowship in integrative cancer therapy. I'm the author of this book, Growing Young. This is a handbook for health that covers topics from spinal health to diet to exercise. Really runs the gamut of a natural approach to supporting health. I own a private practice here in Mounds View, Minnesota, named Mounds View Chiropractic. And today what I'm going to be speaking with you about is diabetes and other blood sugar disorders. So things like hypoglycemia, reactive hypoglycemia, and also insulin resistance or metabolic syndrome. Now, if you're watching this video, you've either been diagnosed with some sort of blood sugar dysregulation. You either have diabetes or you've been told you're borderline diabetic. And so that is what I want to spend the time really digging into today and helping you understand that there are natural approaches that you can take to supporting your diabetes or this blood sugar dysregulation in a healthy manner and actually reverse the changes and the risk factors that are associated with this. It's very important for people to understand that being diagnosed with diabetes is a severe issue. It's not something that's as easy as getting put on metformin, getting put on glyburide, and just being done with it. When you are borderline diabetic or when you have diabetes, it is imperative to be making changes in your life to start supporting proper brain and nerve health, and also to start supporting your metabolic system appropriately to get these changes reversed. If you just continue to do the same things that you're doing, you are going to be on a slippery slope, and I've seen it in my practice. Just to give you a little bit of a background on how I got into working and trying to support patients that have diabetes is actually from my neurology diplomate. So I went through and I trained with the Carrick Institute of Neurology for how to support patients that have different types of neurological disorders. When I got my diplomate in neurology, what I found is that many of these patients, whether it was for balance disorders, ataxia, peripheral neuropathy, whether it was for Alzheimer's, dementia, Parkinson's, most of these patients that have any type of neurological disorder had some level of underlying metabolic dysfunction. And a huge percentage of these patients that had these neurologic diseases were diabetic or were borderline diabetic and not being managed appropriately. And so it became very apparent to me that in order to really help these patients rehab the brain and get their brain healthy, not only did we need to do a brain rehabilitative approach, but we also needed to support that metabolic pathway and get their diet, their nutrition under control. And so that's what I'm going to spend the time talking. You know, I'm a firm believer that if I'm not helping people in my office, if I'm not changing people's lives, I'm wasting my time. My goal in doing this video, my goal is to get this information out to as many people as I can so that we can start helping other patients change lives, so that you can even be changing your own life even without my help. I'm going to try to give you as much information as I can on this video today about the things that you can be doing right now at home to start getting your blood sugars under control, and how this can really help to not only get you reversed, hopefully get you your blood sugar is more regulated, but also get you back to having more energy, getting you back to being able to lose weight, for you to be having better emotional stability, not feeling depressed, you know, being able to enjoy your kids, your grandkids, being able to be active and do the things you want to do. That's what I'm passionate about, and that's what I hope that this video will help you get on the road to that. So in getting started, when we talk about diabetes, it's really important, again, to kind of touch on how diabetes affects us. So when we look at kind of what diabetes is, and really when I'm referring to diabetes, I really mean any type of blood sugar dysregulation. So again, if your blood sugars are swinging violently, whether they're too low or too high, to me that is an issue. So if you are falling too low, that's a condition we call hypoglycemia. And then we also have prediabetes or metabolic syndrome, which means you're borderline. Now, the reason that any of these blood sugar issues is so important to get dealt with, regardless of which one of these you are dealing with, is because glucose is the #1 source of fuel for your brain. So when your blood sugar is dysregulated, when these glucose levels are going up or going down, too low or too high, this damages brain function. This is why we know that patients that are diabetic have significantly elevated risks of developing neurodegenerative disorders like Alzheimer's, like Parkinson's. And so when we're talking about blood sugar on this video, it's very important to understand that this is going to impact so many different areas of your life. Things that you may not even realize that are being impacted right now are being changed. Energy, okay? Energy is stolen away when your blood sugars are not stable. When you have too low of blood sugar, it can cause headaches. When you have diabetes, it causes nerve damage or peripheral neuropathy. This is burning, pain, numbness, tingling. It affects your balance. Falls are the #1 cause of death in seniors. So when you lose nerve function in your feet, your instability is going to be greatly heightened, and you're going to be much more susceptible to taking falls. So nerve function, nerve loss is a major player here. When we look at glucose, instability, again, other things that this impacts hormones, sex hormones, so testosterone levels, estrogen levels, progesterone levels. It affects your sex hormone imbalance. This will cause moodiness, irritability. It can cause deficits in serotonin and dopamine. Okay, so it can affect your moods and cause depression, anxiety disorders. Not only that, but serotonin and dopamine are directly related to how much glucose you have. And if your glucose levels are abnormal, again, you're going to have neurotransmitter imbalances. This is going to affect your moods. This can cause depression, lack of motivation. It can, like I said, lead to anxiety. So getting your blood sugar stable is also very important for overall, enjoying life. Being able to enjoy your grandkids, being able to get out there and play. Neurotransmitters are extremely important. Not only this, memory pathways. As we're going to talk about, when you have blood sugar issues, this is going to be causing damage to two specific areas of the brain that play a significant role in memory. And this is why we see an increased risk of Alzheimer's. So again, when you're looking at your life and where you're at now, if you've been diagnosed diabetic or you've been told you're borderline diabetic, the chances are that you're not feeling great, that you're not living life to the fullest, and you may be seeing some of these characteristics winding up in your life. And this is why it's so important not to just let things be as they are right now, not just to take the medication and try to push down this blood sugar synthetically. Make life changes that can reverse these deficits that are developing in your body. Okay, and I'm going to talk about how we do that and how we evaluate you to help you look at that. Now, in our practice, when we work with any patient that has blood sugar dysregulation, if you come in and you tell me you're diabetic, we are going to do a complete neurologic exam on you. The reason for this, again, is because of this guy right here. When your blood sugar levels are not balanced, it affects your brain and it affects your nerves. There are many people out there that have been diagnosed diabetic that are losing nerve function and don't even know it yet. So when you come into my office with diabetes, we are going to do a complete neurologic assessment to find out, do you have nerve damage occurring? Do you have brain damage occurring? So we're going to go through and test all these different areas of the brain. A couple key things. If the nerves are lost, there's many different types of nerve fibers. Like I talked about earlier, that can influence your balance, but it can also end up causing a really excruciating pain, burning pain that's worse at night a lot of times. In addition to that, when we're having imbalances in the brain, different areas of the brain affect you different ways. So what I want to do is just take a couple minutes and go through these primary areas of the brain and explain to you how it can impact you. So when we look at diabetes, one of the areas that I commonly see impacted in a diabetic patient is the cerebellum of the brain. The cerebellum is this back portion of the brain here. On this picture, it kind of looks like spaghetti. Now, what the cerebellum does is it's responsible for your balance, it's responsible for coordination of movement, smoothness of movement. It also is responsible for stabilizing your spinal joints and your peripheral joints. So when you have poor cerebellar health, what are some of the symptoms that you see? You may see changes in balance, okay? Feeling like you're off center and that you're tilting as you're walking, running into doorways more often than you should. If you have problems in the cerebellum, you may have more back issues, low back pain. You also may create more wear and tear on your peripheral joints, meaning you start wearing down knee joints. Okay, your knees need to be replaced. You have bad hips. Because when your cerebellum is not healthy, you lose what's called shunt stabilization, which are the muscles that are responsible for stabilizing these joints every time you take a step. So if you're not stabilizing that joint appropriately, it wears down faster. So if you've got bad knees, bad hips, this can be a sign of a cerebellum issue. Like I mentioned, it also plays a significant role in the smoothness and coordination of movement. So you may start seeing your handwriting is changing, okay? You might start seeing tremors developing. And this is, again, a sign that the cerebellum of the brain is degenerating. It's very important to assess for this. Now, right in front of the cerebellum, we have your brainstem. The brainstem is composed of 3 parts. You have the upper brainstem, what's called the mesencephalon. You have the lower brainstem, what's called the pons and the medulla. The important thing that I want to talk about in today's video is the pons and the medulla. When the pons and the medulla are damaged, this is the area that regulates your parasympathetic output to your autonomic system. So when we look at your parasympathetics, what that is you can see your pons is here, your medulla is here. All of these green nerves that are coming out, you can see they're running to all the different organ systems. These are the nerves that help regulate all of your organ function in a healthy environment. So on a day in and day out basis, when you're just going through your daily life, these are the areas of the brain that are responsible for regulating proper heart rate, proper heart rhythm, proper blood pressure, normal digestive motility. So when we start developing damage in these areas, you can start seeing arrhythmias develop in the heart. You can start seeing increased blood pressure. We can start seeing constipation, loose stools, fluctuations of both. But we start seeing organ systems start to not work as efficiently as they should. And that can be a sign that we have brainstem issues in that pons and the medulla that are affecting your health. And so another very important area to look at. Now, up in the very front of the brain, we have what's called the frontal lobes of the brain. The frontal lobes of the brain are what make you you. They're what help you make decisions, what help you regulate your emotions, what help you maintain focus. So when we start seeing frontal lobe demise, this is a common area where we start losing short-term memory. You have a hard time remembering what you did last weekend. When we look at frontal lobe issues, we may have a harder time regulating emotion. You start feeling more volatile. You get angry quicker. Okay, you get a little more emotional. You're not able to hold back the things that you wish you could hold back. You say things that are inappropriate. The frontal lobes of the brain play a big role in that impulse control, that impulse regulation. And so when we start seeing frontal lobe failure, that's a sign of early dementia. Now, right over to the side here, we have what are called the temporal lobes. And we'll talk more about the temporal lobes in a little bit. But what the temporal lobes do is the temporal lobes are the area that, first of all, regulate your circadian rhythm. You have what's called the hippocampus, which is in the temporal lobe, and this is the area that sets that circadian rhythm. So it helps you sleep well through the night, and it helps you have good sustained energy throughout the day. One of the things that you're going to see when we have blood sugar issues is that energy is not stabilized. So you're going to have fluctuations of energy. You're going to have crashes where you feel very fatigued throughout the day. This is one player of why that may be happening. Now, secondly, the temporal lobe is also the area for long-term memory conversion. The hippocampus of the brain and then in that temporal lobe is what does that as well. And so when we have the hippocampus starting to degenerate, this is going to lead to memory changes, but eventually lead to Alzheimer's as well. And so we'll talk about some of the mechanisms that affect temporal lobe health. Back here we have the parietal lobe of the brain. The parietal lobe of the brain is your sensory area of the brain. So it's what tells you what you feel. So if you have pain, if you have numbness, if you have tingling, the parietal lobe can play a significant role in that. And the parietal lobe needs to be evaluated in every diabetic patient as well. And then this last area back here, this is what's called your occipital lobe. And this is your area for vision. Okay? Now, when you come into our office, we are going to assess, like I mentioned, we're going to assess your nerves. We're going to find out, are you losing sensation in your hands or your feet? Do you have nerve loss? The second thing is we're going to go through and we're going to do a functional neurologic exam where we test every one of these areas. And we want to see how well are these different areas of the brain performing. And what we're looking for are areas that are excelling and then areas that are damaged or weak, okay, where they're not doing their job appropriately, because that can be influencing how you feel. It can be influencing, as I've talked about, it can be influencing your peripheral joints. It can be influencing your mood regulation. It can be influencing your balance. So when we find whatever areas are degenerating, then we come up with a specific rehab program for those areas. The cool thing about the brain is that when the brain is changing, when the brain is degenerating, the brain is very plastic. So when we change the environment that the brain is in, so when we get your blood sugar stable, when we get all these metabolic issues that we're going to talk about in a few minutes stabilized, and we specifically work to exercise these areas of the brain can change. It can improve and it can heal. And so that's the goal that we have for patients that are dealing with these blood sugar issues. Whatever symptoms it is that you're seeing in yourself, we want to help reverse that, and this is a very important part of that process. Now, on the metabolic front, when you have diabetes, when you have hypoglycemia, when you have any type of blood sugar issue, you probably understand that. You've done a fasting blood glucose, you've done hemoglobin A1C, and you've seen that those are either elevated or, in the case of hypoglycemia, they're too low. Obviously, glucose has to be stabilized. Now, what you may not know is the effect that glucose has throughout your body, okay? So when your blood sugar is too high, what it does is it sends a stress signal to your adrenal glands, and it raises cortisol levels. Cortisol is released by the adrenals in response to stress. Cortisol, what it does, number one, is it causes you to store fat, and it decreases your body's ability to burn fat. So if you ever wondered why it's so hard for you to lose weight, well, until you get this cycle broken, it's going to be very difficult. The cortisol is also used to regulate your sleep and your energy. And so when these adrenals are under chronic stress because of blood sugar dysregulation, again, you're going to see you're not sleeping well through the night. Your energy throughout the day is not stabilized. And so we have to look at what the adrenal glands are doing. One of the tests that we run in our office is an adrenal test where we look at your cortisol throughout the day so we can see what it's doing. In cases of diabetes, we'll typically see that your cortisol levels are high much of the day. When we have hypoglycemia, we actually tend to see it's on the opposite side, and your cortisol levels are low. Okay? But we're going to look at that. Now, the other thing that's important to understand here is that this becomes a web. So, although this all may have started with you eating too sugary of foods over a long period of time, creating a lot of blood sugar instability, and led to all these other issues, what you have to understand is when you're dealing with any type of chronic disease, it's no longer just diabetes. And that's why it's so important to understand that it doesn't help you. It may be necessary for you, okay? But it is not the only answer. The only answer for you is not to just take something to drive down your blood sugar. We want to unwind the web of issues that are going on as a consequence of the diabetes. So when your blood sugar is elevated, your adrenals get stressed, you release more cortisol. Cortisol creates hypersensitivity and stress in your gut. So what we know is that when you have heightened levels of cortisol in your body, your gut immune system is compromised. This makes you more vulnerable to developing infections in the gut. Many diabetic patients will have yeast overgrowths in their gut. This creates bloating, it creates digestive issues, foul breath, okay? So infections, we have to look, do you have yeast overgrowths? Do you have any types of bacterial infections? Okay. Many diabetic patients also have bacterial infections like H. pylori, which cause acid reflux type symptoms. We look at parasites, okay? Now, in addition to this, the other thing we see with diabetic patients is you're going to have an increased probability of developing hypersensitivity to foods. So in other words, your immune system becomes reactive to foods that at one time you could eat and You still felt great. But now your immune system is reacting to these foods that you've never had issues with. And you may or may not know that you're having reactions to these foods. Your only symptoms of reactivity to these foods could be that you feel wiped out all the time, or that you're getting headaches, or that your balance is deteriorating, okay? But what we have to look at is, do you have foods that you're eating that your immune system is now reacting to? And when you're diabetic, when you have cortisol surges like this, your risk for developing food reactivity is very heightened. And what happens is this becomes this whole cycling cascade. So in other words, now you have poor blood sugar management, you get these spikes of cortisol, and then what ends up happening is these spikes of cortisol cause you to develop food intolerances. Well, what did we say that the adrenals do? The adrenals react to stress. So then every day that you're eating a food that your body is reactive to, you're triggering an immune response, and your adrenals get triggered again, which winds up more blood sugar instability. And your blood sugars become harder and harder to regulate, harder and harder to manage. Same thing if you have a yeast overgrowth. Now you've got this chronic stressor going on against the adrenals. And so you're winding up this whole cascade where you're causing more cortisol release, which is affecting your energy, it's causing you to gain weight, but it's also creating more blood sugar instability. As a consequence of this, you're developing more and more foods that are becoming reactive to you. And what happens is if you have these things going on, no matter what you do, you can make simple dietary changes, you can avoid some simple carbs, simple sugars, but you're still going to see that you have a hard time regulating your diabetes overall because you haven't got rid of now the foods that are causing the reactions, you haven't got rid of the infections. This is an inflammatory process. And again, when you have these inflammatory conditions, this drives increased risk for heart disease, increased risk for nerve damage, increased risk for brain damage. And so we want to put an end to this inflammatory cascade that's going on. Okay? Now, other areas that we also want to address and look at. As I mentioned earlier, glucose is a direct precursor to your neurotransmitters, serotonin, dopamine, in particular. Dopamine plays a significant role in your movement pathways and what's called the basal ganglia. It also plays a significant role in your focus, your ability to pay attention. Okay? Serotonin plays a significant role in, is kind of your happy neurotransmitter. So it makes you feel good. When you have serotonin deficiencies, you start losing motivation, you start becoming depressed. Okay? When your blood sugar levels are unstable, it affects your hormone, or your neurotransmitters, and will throw that off. Secondary to that, your adrenals also release what's called DHEA. DHEA is a precursor to estrogen and testosterone. Okay? And so what happens is when your adrenals are under chronic stress because of all these things firing into the adrenals' number one goal, like we said earlier, is cortisol production. And so one of the very first things they will do is they will stop producing DHEA in order to keep up with the demand for cortisol. Now, as a consequence of that, that throws off your sex hormones. Okay? So you end up with hormonal imbalances, and if you're a female and you have too much testosterone, that's an issue. If you're a male and you have too much estrogen, that's an issue. And it creates an increased risk of heart disease, increased risk of inflammation, moodiness, irritability, increased fat storage. Okay? So it can affect many areas when you have these hormonal imbalances. The other thing that's really important to understand with this whole process is that when your glucose levels are elevated, you also go into a process called, especially in males, you go into a process called aromatization, where you will actually aromatize testosterone into estrogen. So outside of this loop, you will actually be making your testosterone into estrogen, which makes you estrogen dominant. Again, significantly increasing risk of heart disease and creating a lot of other issues such as weight gain, and plays a significant role in all these pathways that we just mentioned. So again, this is a really important thing to look at and assess for to see if you're actually aromatizing your testosterone and estrogen. Now, other things that we also want to address. We mentioned earlier about the temporal lobe of the brain and how this regulates your sleep-wake cycle, but it's also your area that's responsible for long-term memory conversion, okay? Again, this is the area that degenerates first in Alzheimer's disease. So when we look at the temporal lobe, what I want to point out here is that when you have chronically high levels of cortisol, cortisol specifically damages your temporal lobe of the brain. And this is where we start seeing memory pathways burn, we start seeing more brain fog, memory lapses, okay, harder time processing information, slowing of your processing speed. And so, again, when we start seeing brain fog, changes in memory, this is a sign, again, that cortisol is actually damaging that temporal lobe of the brain, and we're seeing signs of early neurodegenerative change. The important thing to understand is that when we're talking about diabetes, these or any type of blood sugar instability, these are things that have to be looked at, because when this has been going on for any extended period of time, it is not just a matter of taking a medication, addressing blood sugar, and everything's going to be dandy. When we're dealing with diabetes, when we're dealing with metabolic syndrome, reactive hypoglycemia, what we want to look at is how has it wound up this web? How has it affected your adrenals? How has it affected your gut health? Have you developed food intolerances? Do you have underlying infections? Has it thrown off your neurotransmitters? Okay. Do we see changes in your cholesterol to triglyceride ratios? We want to look at all of these things because it's very, very important that we get all of these areas addressed and stabilized. In our office, we do we have very good results in working with patients that have any type of blood sugar instability. And if you're dealing with secondary consequences of this blood sugar abnormality, you notice that your memory is shifting. You notice that your balance is changing. You're having chronic migraines or chronic headaches. You have neuropathy. What I can tell you is we get great results for our patients that are dealing with these issues by not just addressing your glucose levels, but really looking at the big picture, helping you make lifestyle modifications that are going to help you to address this web of dysfunction that's going on, and then also doing specific therapies in our office to rehabilitate any changes that have occurred in the brain and or the nerves. As a consequence of that, we've helped a lot of patients that are in these shoes. So if this is you, if there are areas here where you're saying, yeah, I have these issues, I know I'm borderline diabetic, or I've been diagnosed diabetic, and I know my numbers aren't where they need to be, and you're wanting to see if there's anything that you can be doing from a natural perspective to help take a supportive role to whatever medications you may or may not be on, then that's what we're here for. I would love to have the opportunity to talk with you and meet with you and see if it's something that we can help you with. So what you can do is you can give our office a call. Our information is obviously on this DVD. Give our office a call. You can schedule a free phone consultation where I can touch base with you briefly and see if you would be a good candidate for care in our office. You can also schedule an exam and get scheduled to meet with me, where we'll go through and we'll do a full neurologic workup and see how this is impacting the health of your brain, the health of your nerves, the other metabolic pathways. I encourage you to take some action, whether it is just doing your own research and starting to support some of these areas that we've talked on today, or whether it is coming into our office and seeing what we can do, or finding another provider that works in this field. I encourage you to do something, because it's something that at this point, if you're early enough, these changes can be reversed, they can be stabilized, and you can prevent, not only reverse some of the negative symptoms you're having now, but prevent a lot of future health issues by addressing it now proactively. Remember, you only get one go around this thing that we call life. And you want to be healthy, you want to have that vitality, you want to be able to add to other people's lives. Like I said at the very beginning, my goal is, if I'm not helping if I'm not helping other people in my office, I'm wasting my time. My goal is helping other people, and I think life is really about helping change the lives of other people in a positive manner. And that goes for you too, right? So you want to be able to give back to other people. And if you're not in a state of health where you can do that, you're wasting time. And so take action, give us a call, do some research, whatever it is that you need to do to start acting on this. I hope this DVD was good information for you, and if you have any questions, like I said, give our office a call and we'd love to talk with you. Thank you so much for your time. God bless. Okay, I'm here with Jim, and Jim, we're just following up from, I think last time we spoke with you was about, probably about 4 weeks ago?
That is correct.
Good. And so since then, you've been going back to your medical doctor, and what have been some of the progression that your medical doctor has seen, and how has he responded?
First of all was the weight loss. I've lost 20 pounds. I've been on the program for 60 days. And then my A1C was at 11, 9 to 11, and now it's down to 6.9. He was very happy about that. And he's also taken me off of all the Actos, and he's cut my atenolol down, and he's reducing my insulin also. So he's very pleased with this program and how it's working.
That's wonderful, and so and that's great to see your hemoglobin A1C drop that many points while you've been reducing medication. So that's phenomenal. And how is your energy level coming?
Energy level is coming back. I still don't. I have my neuropathy. That's totally gone, and everything's going really well. And I'm on Clearvite now, and so I'm anxious to get started with that. Get a little more protein in.
Wonderful.
That'll help.
Wonderful. So the neuropathy is completely gone at this point.
Yep.
Wow. Awesome. Well, very good. We're very excited for you, and I know that you're you're excited, and we'll just continue to plug away at this thing. So,
thank you.
Congratulations.
Thank you very much.
Okay, I'm here with Jim. Jim, welcome.
Thank you.
All right, and so Jim, when you first came into our office, what were some of the main symptoms, concerns that you had that you were dealing with?
Primarily neuropathy in my legs. Although after enrolling in the program here, it involved a lot of other things which were a real benefit to me, including weight loss.
Wonderful. And so when you came in, we did a neurologic evaluation where we assessed the neuropathy. We also did a number of brain-based tests, and then we also ran a number of lab tests. After doing the exam and getting all the lab tests back, did that seem to help clarify kind of the path that we needed to take to get you well?
Indeed it did. Primarily I didn't realize that I was gluten intolerant, and it made a big difference in my weight loss. I have gone to Weight Watchers twice and failed, and here I've lost approximately 20 pounds in about 3 to 4 months.
Wonderful. That's great. And so as we went through the program, we worked with you, we changed your diet, obviously. We took out the foods that your body was responding to. We found that you had some leaky gut issues. We also helped support your blood sugar, right? We worked with you, and
correct. Prior to starting the program here, my endocrinologist was very pleased with my A1C of 7. After about 3.5 months on this program, my A1C is 5.7.
And what have we done in the meantime? We've taken you down, or we've worked with your endocrinologist
right.
to decrease your medications, and
right.
How have your medications been effective?
I was taking a large amount of metformin, which I no longer take at all, and my insulin has been reduced significantly.
Right, and so that's great, right?
Indeed it is, yes.
Okay, and so like we said, 4 months into the program, how are you feeling? How are your legs feeling? How is your energy? How is like you mentioned, the weight loss?
My legs are significantly improved. My balance has really improved considerably, and obviously my weight loss has been very successful.
Good, and we're getting it, and you're been able to get off medications and see good results, right?
Exactly, absolutely.
Good.
I'm very pleased. I would recommend the program to anyone.
That was my next question. So you're a step ahead of me, Jim. Well, thanks so much for taking the time to share, and we'll kind of follow up with you as we continue on and make sure that things are continuing to make even more progress. So thanks so much.
Thank you.
Hi, I'm Lee Wallman.
Okay, Lee, so today is day one of treatment for you. And can you just tell us a little bit about your condition and what you came into our office for?
Well, I've been diagnosed with neuropathy in my legs, and it's caused a problem with weakness in my back, weakness in my legs, climbing steps, and it's creating a balance problem for me. I feel sort of unsteady at times. I sometimes feel I have to watch out so I don't fall.
Okay, Lee. And how is this affecting your daily life? What are the things that you're not able to do that you would like to be able to do because of the condition?
Well, it's becoming more difficult to do yard work. I do enjoy gardening, and I've had to give up some of these things because just the problem of weakness in my back has slowed me up considerably in doing a lot of these things.
Absolutely. Now, you also have some issues with digestive function as well. How long has that been going on for you?
Oh, I would say that's been going on for 3 to 5 years. I can't remember exactly, but
Okay. And you had mentioned that you have some issues with memory as well. What kind of memory changes have you noticed?
well, I'm having a little difficulty once in a while. I enjoy talking with a friend about a lot of different subjects, and I'm having a lot of trouble coming up with names of people I want to talk about, whether it be politicians or whatever. And I'm having trouble. I sometimes it's hard for me to stay focused, and when I decide I'm going to do something, once in a while I get to a point where I can't. It's difficult to explain. I can't always remember exactly what it was I set out to do.
Yeah. Okay.
Whether I I decide I need to go into another room to do something, and I get there, and then I wonder, why am I here?
Okay. Okay. Yeah, and so how do you feel about where things were headed for you as far as your health goes?
Where we're headed?
Well, where do you think things have? How has your health been going for you up to this point?
Well, it just a lot of nagging problems with digestion and swallowing, and
Sure.
this weakness has been getting steadily worse,
Okay.
rather rapidly worse.
Yeah.
In the last year and a half.
Okay. And what are you hoping to get out of working with me, Lee?
Well, I do. I was hopeful that apparently I have a lot of problems that are related in terms of maybe diabetes, thyroid, and apparently these all relate to the problem I have with the neuropathy, and I'm hoping that I can receive some portion of relief, even though it isn't a complete cure, at least, so the symptoms don't get worse, and hopefully can create a little bit better quality of life than I have now.
Great. Well, Lee, thanks for answering the few questions we had, and we're looking forward to having you as a patient. Look forward to helping you get your life back. Okay. Have a great day.
Yes, I just wanted to mention that my blood sugar has been quite normal. I've been ranging in the maybe between 100 and 110, and once in a while it goes up, like to 121 after a meal. But it's been staying fairly consistent. in that area. I have had a lot of weight loss, which I'm happy about. I had last July I was at about 270 pounds, and now I stepped on the scale this morning. It was 203 pounds. So I am losing weight, which I'm happy about.